When we're looking at biosimilars compared to the originator product, the side effect profile should be the same. And that's reassuring when a patient has to change because they're used to the way a product looked or a patient support program that has helped them along, and now as they transition, they feel something's different, but they should do the same. And it's key that we talk to people and tell them that they really are well tested. But before that, as drugs came to market, as a good stewardship, in my opinion, was that if you can get equal value for helping your arthritis, your rheumatoid, or other problems that you have where it's approved, if you could get equal value at less cost, would you like to change over? You should do the same, not better, not worse. You should be the same. Other people would say, well, you know, I pay a lot for getting this benefit of having a really good drug reimbursement program. Will my costs go down? And I would often say, no, they'll probably be the very same. So people would make different choices, and people are afraid of change. I'm afraid of change. If I'm doing really well, it's been tested in head-to-head trials. In Europe, they have transitioned people for about 10 to 15 years on some of the products. So we have a lot of real-world data that should be very reassuring. People should do the same. But no one is ever going to be 100% on any product over time. When I'm seeing my patients, particularly rheumatoid arthritis, I have a big RA practice. A lot of people will say, I've heard about the biosimilars. I'm kind of fearful that I'm doing so well. I don't want to change. Do I have to change? Or what if I change and I don't do well? Does that mean that the product's a dud? And if you're not doing well, we know that in our CATCH cohort, our early arthritis cohort, that there is a rate of flaring on any day. I guess we would know that just in the general population, there's a rate of someone having a headache any day. There's a certain percent of the population. So we have to really balance that. You might be flaring and you might be more attuned to tell me you're flaring, and there are really good studies, including Canadian data, that say it's the same. The nuisance side effects are the same, the benefits the same, and I think that helps. Some other questions are, well, will I save money or will my copayment be more? Wouldn't that be horrible if a product is, a copayment is helped on some of our drug reimbursement is not 100%, but in general, the patient support programs have come out to look the same on benefits that the originator program had, so that from a patient perspective, it should be seamless and it shouldn't be any out-of-cost expenses different from what it was before. And we try to reassure them for that. And I even cue them, because we have a lot of biosimilars for the products I use, that if something's not going well with that patient support program, or the way that pen injects, or the needle syringe, you don't like it so much, it's hard for you to hold in your hand, then let's talk about it, because we're fortunate to have a lot of other biosimilars, and you might find the one that feels best for you.